To all the ladies and gentlemen outside there watching us live, how are you doing? How has been your day? My name is MC Tap Original. Today in the house we have a visitor. Today we are in Buyaga Town Council, and that is Bulambuli District. We are going to discuss about Royal Clouds Medical Center. So today we are discussing about health services. You might be living around Sironko District, Bulambuli, Kapchorwa, Boko, Kwen, Karamoja, and you need a place where you can get quality health services. So today we are with one of the directors of Royal Clouds Medical Center, and we are going to discuss with him a few things so that we can get to know where is this place and the services that are rendered here. Papa, you can greet the viewers before we continue. Tell them your names, they get to know you before we continue.
First of all, let me say thank you for the opportunity that you have granted me to have a chance to say something to the masses who are the major reason why running this business. Good afternoon, viewers. I'm called Francis Okello, one of the directors of Royal Clouds Medical Center. I'm privileged to have this opportunity to talk to the media house and our customers largely. The patients who come are actually within the locality here, which is why it's an opportunity worth appreciating. Your coming today gives us a chance to tell our viewers who we are as Royal Clouds. Royal Clouds is one of the regional giants in offering medical services, largely in the Elgon zone. Our services started from Kaserem, that's in the Kapchorwa district, but out of demand, it has given us the chance to expand to all parts, different parts of the Elgon zone. Currently, out of demand, we are here in Buyaga. Buyaga was established largely to respond to the demands of our customers who used to trek longer journeys from this side to Kaserem.
Okay.
And if we had to answer their call. Repeatedly, they would ask for a service to be opened closer to them. And in our own judgment, Buyaga, we had to extend our services to begin with Buyaga.
So, Papa, as you've started for us that nice story, from there, let's just proceed. So, what is your long-term vision for Royal Clouds Medical Center?
Royal Clouds Medical Center is envisaged to serve the whole Elgon zone in a spell of between 2 to 5 years. We should have covered all districts of the Elgon zone. That is ranging from Mbale up to Boko. All the districts in between or within that zone will be served by Royal Clouds in the region in a spell of 2 to 3 years.
Okay. So, Papa, how do you ensure quality health services at Royal Clouds?
At Royal Clouds, we only engage personnel, highly qualified personnel, to run all the departments of the medical center. And we also have a board of directors who are well experienced, who are managing the facility and planning for it.
And that is something that has made Royal Clouds to be the best.
True.
So, which challenges have you been facing as the health center, and how are you addressing such challenges?
Of course, like any other body company, there are challenges. In our case, the main problem, the main setback is the perception that we are expensive. People, the community has not yet believed that these services are meant for them.
They think they're expensive.
They think we are expensive, but we are not. We actually designed these services to have a pharmacy that brings in drugs at a cheaper rate, so that even the medical centers can now give sell the service to the patients at a subsidized price. Our prices are affordable, and they are really meant for a common man. Every person can manage to be served by Royal Clouds.
So which means this health facilities to serve a common man?
The facility is largely meant for the common man. And this presentation is to show people that everyone deserves quality services, regardless of who you are, your origin. See?
So, Papa, how do you support staff motivation and the professional growth?
We have here a human resource setting that takes care of our staff. We provide a number of things. First of all, the uniforms. When you come to their personal problems, we take care of them. We provide meals, we provide health care services to our own staff. We pay them in time and remuneration is good enough that motivates. And generally, we listen to them. We make them part of the management on average. We share issues with them and they freely discuss these issues with us, and which makes everyone here feel at home.
Okay. So that is something very good, because in most places, people fail to connect.
True.
So, Papa, which plans now do you have for expansion or developments for this place?
Actually, our own limitation at the moment is that all our branches that we are talking about are in hired houses. We plan to buy land of our own and build a reputable hospital that can bring together all these services,
people,
but with a direction to serve the whole region.
So currently you're hiring?
Currently we're hiring. That's the only major limitation actually.
Okay.
Hiring is a cost.
So what do you believe that the community plays? Which role do you think the community is playing towards the growth of this facility?
Of course, as like any other business, we depend on the community to support us. These services are meant for them. We brought these services right to them to eliminate the higher costs of traveling, say from here up to Mbale. Now the services are brought nearer home. It is actually imperative that they embrace these services, support us so that we each benefit from the other. They support the facility while we also offer quality services, quality medical services to them.
Okay, so how do you ensure affordable and accessible health services here?
We ensure, that's actually what I had just explained before, that why always medical services are expensive is that people don't run a pharmacy. And pharmacies generally, their setting is to sell drugs at a lower price. So by having a medical unit on one side and a pharmacy on the other side, we are able to use the lower prices of our pharmacies and extend them to our patients, such that they can get access to these services at a lower cost.
Okay.
But also, we also have equipment that actually has brought in efficiency, like for scanning and radiography and other plans that we have, make the services actually cheaper.
Okay.
A patient does not have to travel up to Kampala for like scanning.
And everything is done.
Everything is done from here.
I think that is indeed very good. So what can you tell the viewers and the customers and the community as we close?
I still have to appeal to the community that these services are largely and primarily meant for you. Don't mistake this place to be costly. You have designed a setup for you, meaning that even a common man should feel free to come over. We shall accommodate you, even where your pocket may not be good enough. Come and we discuss it. We shall first of all prioritize your health, then eventually
other things come
later.
Okay. Thank you so much, Papa, for explaining to us. And now, right now, we have known very well Royal Clouds Medical Center.
Yes.
To our beloved viewers, this is a place where you can get affordable, accessible, and quality health services in the heart of Buyaga Town Council. Thank you so much for watching. I wish you the best of your day.
Thank you.
Ladies and gentlemen, once again, it is MC Tapo Rigno. We are still at the Royal Clouds Medical Center that we interact with the professional healthcare providers from this place so that we can also get to know more about this health facility. Sir, you can first greet the viewers before we proceed.
Okay, thank you very much. The team from media. I'm by the name is Dr. Arab Malinga Lawrence. I'm a professor by profession, and I work with Royal Clouds Medical Center. So once again, you're welcome, and everyone listening to us, please welcome. Thank you.
So, big man, we would love to know what are the common health cases that you handle here.
Okay, thank you very much. The health cases which we handle here is a wide variety. We call it general practice. So maybe I would classify them in terms of pediatrics. Pediatrics is children cases. We call it pediatrics. So pediatric cases can be having fever in these children, can be issues of convulsions, what, all cases concerning children, we handle them. We do what we call general outpatient care. General outpatient care is patients who come in and go. Maybe those who come and see the doctor and they go home. And this can be mainly medical, classified into medical cases. And the medical cases are so many. We have those ranging from those which are infectious to those ones which issues like diabetes, you have issues like blood pressure, high blood pressure, you have a number of them on medical side. Then we have those surgical cases. We handle surgical cases, minor surgeries here. And the minor surgeries we handle here are, we have hernias. Sometimes we do hernias here. We do things like hydrocele. We handle it here. We do hydrocelectomy. We do things like wound dressing, which is the simplest. Then issues like maybe simple swellings. After scanning, obviously, we do that. So that is it on that case of that.
Okay.
Then we have the obstetrics. If you have a mother who wants to deliver, you can bring her here. We shall also handle. Then the other thing is we have other services which we offer here.
Like?
We have things like scanning services which are over here. We have things like even pharmacy part. If you want drugs, please, you can still jump in to Royal Clouds Medical Center and you can still pick your drugs. So those are the cases. Even lab services. Our lab is up to date. We have so many things we do there. Thank you very much.
Yeah. So, doctor, how do you manage to offer accurate diagnosis and treatment to patients?
Yeah, according to Uganda clinical guidelines, there is a policy of test and treat. First of all, every patient who comes, we have to do what we call history taking, which is ideal for every medical professional. So history taking, we do a history taking. After history taking, examine. Then after that, we test. We do tests, and we have all of those tests here, ranging from simple, basic tests to even those complex ones.
So you first test,
We
then
test.
you treat.
After getting that, then we now treat based on that. Thank you.
So what challenges do you encounter in your profession here?
One, it being a private sector. You know, in Uganda here, it's a bit challenging. Private sector, you know, it depends on the patient pocket. So there are a number of challenges. You want to ask for these tests, but of course, because the patient may not afford, so it's a bit challenging. But obviously, we are here and we are pocket friendly. In terms of our tests, we do them as simple as possible, such that we can see that our patients are what?
You help even those who don't have much in the pocket.
Exactly.
Okay. So how do you work with the other staff to make sure that the health care of the patients is risen?
Okay, so one, here we are a bit organized and we have put structures in place. As a patient comes, we have a team. We have a team of nurses which receive patients. After receiving patients, they take vitals. After taking vitals, they triage and they communicate with the doctor. So we handle them immediately basing on the emergency and the non-emergency. So we do triaging. After that, we handle this. So patients here don't spend time. Once they reach here, we handle them. There you go.
Okay.
And that is it.
So what improvements would you recommend for better services?
Yes, I know this would be a general thing which cuts across in the whole country. I would maybe advocate, if I was there as policymakers, we would advocate for things like national insurance. Because once national insurance is there, people become, it's easy to treat everyone. Because at the end of the day, facility can claim to gap up the issue of pockets. Then the other thing is obviously the improvements which will, in future, we are thinking of bringing specialized cases, issues here, so that on specialized basis, we handle things on special. So that is it on our Thank you.
So how do you handle emergency and critical conditions here, or critical cases?
Okay. So handling emergencies or critical cases here, first of all, we are a basic. And basic facility is we are able to give basic care. So it being basic care, we don't have blood. That's the reality. So we can't give blood. But on the other side, there are those emergencies which needs attention. In most cases, when you come to the medical setting, you find that even this your blood is not the first thing first. Always first handle this. So we have the oxygen. Yes, so if there are issues where you require oxygen, we have emergencies. We first act first and look for the cause of the problem. Once we identify these problems, we want to handle to our best, and then we refer. Referral is part of management. We refer to a higher level where they can give blood, which we lack here. But we make sure we are always in touch with these patients, handle them well, and then even where we refer them, we tend to follow up to see that our patients receive utmost care.
Okay.
Yeah, but so, once we become comprehensive, we shall have all the things in place. But currently we are basic and we are doing well with it. Yeah.
So what can you tell the viewers and your clients outside there?
Our viewers, truth is this facility has come to help the people of the place, and the service is brought nearer. This is a facility with the doctors and the clinical officers and qualified nurses. So and they're just providing all this care at a low cost, affordable. So mine is, as long as you are sick, please pass by and get our services. So I don't have much to say, maybe that would be the issue.
Okay, thank you so much. All our viewers, that has been the doctor from Royal Clouds Medical Center, Buyaga. I wish you the best of your day. Ladies and gentlemen, you're most welcome in another nice session. Still at Royal Clouds Medical Center, Buyaga. I'm with the receptionist. You know, in every home, as you just reach there is someone who receives you. So today, I'm with the receptionist. My name is MC Taporigno. So, Madam, you can first greet the viewers before you proceed.
Okay, thank you so much. I'm called Dong Mercy, receptionist, Royal Clouds Medical Center, Buyaga.
So, Madam, how do you manage the patient's registration?
Normally, in patient's registration, all the patients we receive, being it new or old, first of all, with the new patients, we have a system, that is our computer, whereby every patient that comes in is entered in the system and obtains a patient identification number, such that when that patient comes back the second time, we don't have to enter the patient, we just have to search that identification number. That will take us to the patient's previous biodata. Yeah. And then in the old patients who keep on coming for review, it is still the same thing. Now, in that we keep this patient's information in the system, no one is able to access it unless you have the patient identification. Yeah.
So how do you, what challenges are you always facing here as the receptionist, and what steps have you taken to fight them?
Now, being a private sector, based on the challenges we face, normally we, based on the policy of first come, first serve. That is what applies in a private sector.
Okay.
Compared to a government setting.
The one who comes first?
Comes first is served first. Whereas in a government setting, we triage. Yeah, we triage looking at the critically ill, and then much as, but we still under emergencies. But here we based on first come, first serve, because here the clients we get expect to be served first. The one who arrives first is attended to. Yes.
So how do you ensure quick and friendly customer services?
In quick and friendly customer service here, first of all, we have very many people who do different jobs. Like we have a receptionist, a pharmacist, a nurse, doctor. In that, when we receive a patient, the triage nurse, that is the first patient. The first nurse, the first person who actually comes into contact with the patient is a triage. Then that one directs the patient to the reception. The reception will finally do the work very fast. Then direct the patient where to go next, maybe to the nurse to do their vitals, and then direct the patient to the doctor's room. In that, the patient is what? Goes from one point to the next smoothly without wasting time. And then the second thing is, when we have many clients, all we do is reassurance. In case the doctor is busy handling an emergency and a client walks in, we have to reassure the patient. Reassurance is to tell the patient, doctor is soon coming out, and then we'll attend to you.
You give hopes.
We give hopes.
So
in as much as we work, the hopes we give are not false. We actually work accordingly.
Oh, okay. So what suggestions or what improvements can you suggest so that your service flows well?
Currently, the improvement I would bring across is a stable power supply for the internet. Yeah, because normally when we run out of power, much as we have a generator, it would be better if it was automated. So that when power goes off, the generator switches on. So that we don't get out of power, because the system mostly is based on the Wi-Fi. Yeah, so we didn't want to get lost of the internet connection.
Okay. Yeah. So how do you maintain confidentiality?
Confidentiality is basically in nursing and medical world. The medical field, it is one of the ethical code of conduct. Like we have to maintain patients' confidentiality, so it's also one of our priority. Yeah, that is why in the system, when we obtain a patient's medical history and all the tests done, could be the results of the scan, the lab test, and the medication. It is what? Stored there, and in that no one else is able to access it, because these patients, like a patient has its own password. Yeah, so all the information data, all the patient's information is actually stored. Yeah, and then it's not accessed by everyone. In that now, the patient's information is not with the public; it's only with the medical professionals. Secret. Exactly.
Okay, so what can you tell the clients and the viewers as we wind up?
To the viewers out there, I encourage you to come and visit us at Royal Cloud Medical Center, Buyaga. Here we do this free consultation. You can come and consult with our doctors. We are always available and open 24/7. Yeah, so I encourage all of you, the viewers and everyone out there, to come and see us at the medical center here in Royal Clouds.
Okay. We are still pushing on with Royal Clouds Medical Center, Kaserem branch. We are with the nurse and we want to interact a little bit. We get to know this and that. But before we go any further, let her first greet us before we continue. Sister, first greet us.
My name is Lotang Fatima. I'm an enrolled midwife working in Royal Clouds Medical Center, Kaserem. Yeah.
How are you doing here? How are things moving?
Things are moving on well.
What is your daily routine in what is your daily routine in attending to the patients here?
Our daily routine is when we report for duty, we start by making sure the environments are clean in which we are going to operate, dump dust. Then the patients we receive, we normally welcome them at the reception. We inquire the reason as to why they have come, because most of them come for different reasons. Others come specifically for scan, and then there are those who come to see the doctor. There are those also who come for review. So it is necessary you ask them, then you proceed from there.
You first find out everything.
Yeah.
How do you ensure patient comfort and safety here?
Patient's comfort and
Eh,
safety.
comfort and safety.
When we receive the patients, for example, those who are not familiar with the language, because most of the locals, others don't understand English, we make sure we get someone who understands the language among us, the staffs, to talk to them, and then there they would openly talk about their problems to them.
So which means you have different staff members with different languages?
Yeah.
Okay.
Yeah, not all of us speak the same language.
Okay.
Others know 2 to 3 languages. Others 2 like that.
Even you know more than one.
Yeah, I can speak more than 3.
Okay.
Yeah.
So what challenges do you face in your field?
As in
nursing, as you're a nurse, in your profession here, as you do your work?
the challenges are
Like which challenges do you face during your work as you a nurse here?
actually, as per me, the only challenge I face is the language, the Cook Sabine language, because I'm not a Sabine. Actually, that is the only language the only challenge I have yeah, when handling the patients.
How do you rate the patient's cooperation with you here?
I can say 98 out of 100.
So they are too cooperative, eh?
Yeah, they cooperate.
Okay. So what improvements do you expect so that your work can flow on very well? That the improvements that should be put in place so that your work can flow on very well?
I can say stocking the drugs in time. Yeah, I can say if the drugs are stocked in time, yes. Then also timekeeping, yeah, for all the staffs when they're coming for duty. And then maybe soft skill, how to handle patients. We the staffs have to know how to handle patients in a way that they feel at home and they keep coming to receive the services. Yeah.
How do you manage the maternity services?
With the maternity services, we actually receive a few, not a large number, come to deliver the medical center here. Yeah, we have the delivery bed. Yeah, when we receive the mother, the midwife on duty normally attends to the mother, assesses the mother, and then calls the doctor to confirm the assessment. Then the proceedings continues. In case of anything, you alert the doctor. Yeah.
So what about handling special cases?
When we receive, we first manage as per our level. When we find that the condition of the patient is above the level of the facility, we refer them immediately to the hospital, that is Kapchorwa Ltd.
Okay. So what can you tell your viewers who are watching, all the clients and the community at large?
Royal Clouds Medical Center, the branch we have here in Kapchorwa district, we are hoping to welcome anybody with any kind of sickness. They can usually approach us anytime because we are open 24 hours. Yeah. Anytime you come, you'll find the nurses and the midwives are ready, plus the doctors. Yeah. They can feel at home to come and share with us all their health problems.
Okay.
Yeah.
Ladies and gentlemen, we are still pushing on with Royal Clouds Medical Center. Don't get tired because your health is wealth. This is Kasarem branch and I'm with the marketing officer who will greet us before we go any further. My name is MC Taporigno. Mama, first greet the audience before we continue.
Thank you so much. My name is Navde Edith. I'm a marketing officer of Royal Clouds family.
I
call it family.
Okay.
Yes, but most especially you find me here in Kasarem. Yes.
So, Mama, how do you ensure that the public is aware of the services that you're offering? Because we hear that since you people are organized, the place is smart, people say that you are expensive.
We are not expensive, my brother. I think I'll take this opportunity to let you know that I always do outreaches. I move sometimes home to home visits to explain to them very well about our medical center and the services offered here. So when you move around Kasarem, it's only Royal Clouds Medical Center which has the best services. Why? We have CBC, we have ultrascan, we have RBS, we do tests. We do even RBS and the others. Even doctors are there in time, 24/7.
Okay.
We are there.
Okay. So now, apart from those one, apart from the people from around Kasarem Center here,
Yes.
do you also reach other places that are far away from here?
I reach far areas like Bulambuli, that is Bulago, Lusha, Wakadala, even to Karamoja side. I've ever reached there. That is Nabilatuk, Namalu, Rorachat, all those areas. I've been doing marketing there, and my people know this place. Even as you move to far the downer side, Bulambuli, that is Ngenge, Bunambuche, there is Cheptui, there is Bunangaka, all over Muyembe. At first they used to come to Royal Clouds branch of Kasarem. Yes.
So now, as the population increases, we know the population is increasing, the patients are always there 24 hours.
Yes.
Assuming one day you wake up when you've received a big number of patients.
I have a good team of staffs who are working in Royal Clouds. To the point that even though that one who is in a critical condition, we have oxygen cylinder within our facility. Yes, so the services offered is the one making others to go back and say, if you are in a critical condition and whether you are how many, we have a good number of doctors. We have 3 in Royal Clouds Kasarem branch. We have a number of nurses and midwives also. So we even do deliver in our facility.
Okay.
Yes.
So what improvements do you expect to put on ground?
Okay, the best and the most is I'm praying that if my ED can work on X-ray, that one will be the best. Reason being, as we are in the hill area, that is Chekwatit, most people get accidents from there, and as they come here, they really feel like doing an X-ray, but unfortunately we don't have it. So I'm really praying that may the Almighty God answer my prayer, that our executive director works on the issue of X-ray.
Okay.
Yes.
So in your field as a marketing officer,
Yes.
what challenges do you face?
Very many. Very many. Most especially when it rains. The roads are too slippery. Hard areas to reach. Sometimes when you live here early, you may even reach there late. That is also another challenge. Another thing is that you may move and then your motorbike gets stuck on the way. Like for example, if it gets spoiled, then it takes some good minutes to repair before you again start moving.
And it leads to delaying.
Yes.
Okay.
Yes.
Now there is the issue of language barrier.
I'm too blessed that I know most of the languages.
Okay.
I know Lumasaba, I can even greet you to Mlembe Baba.
Remember, man.
I know Lugwele Koizeyo.
Hey.
I know Ate Soyo Ganoi Papa. When I come to Kupsabi with the men, I say Takwenyo. Then with the ladies still, Takwenyo Chamune.
Hey.
Miteso. English, I'm good in it.
Okay.
And the other languages, I have like 8 languages.
So you're blessed.
I'm really blessed.
You're really
I
blessed.
thank God for that.
Okay.
Yes.
So what can you tell your customers and the entire community watching you outside here?
Yes, to my members who are listening to me, I still say hi to everyone. And I welcome you to Royal Clouds Medical Center. It is the best within Kapchorwa district. So even my neighbors around Bulambuli, Muyembe, And everywhere, please, if you have any patient, bring our clients and we attend on them. We have oxygen cylinders, scans are there 24/7, lab tests, they are there all the time, even though you come at midnight.
You're there.
You are worked on it.
Okay.
Yes.
Thank you so much, Mama.
Thank you too.
You've really showed us what is Royal Clouds, and I'm feeling that even though I just get flu, I have to run from where I am, I come here.
Within 1 minute, you are worked on and the flu will disappear.
Okay.
Yes.
Thank you so much, our dear viewers, for following Tap Media. The Mama has been so good, but since we have a lot of things to do, let's end here for today. Have the best of your day.
This is Edith, Marketing Officer, Royal Clouds Family.
We are still with the Royal Clouds Medical Center, and today we are in Kaserem, in another branch. We are with the administrator. We want to know how are things running this side, how are things moving. So you can first greet the viewers, tell them your name before we continue.
It's my pleasure and I'm delighted to have this interaction. I salute all the viewers. My name is Saek Osman.
Okay. So, Mr. Osman, what is your long-term vision for Royal Clouds Medical Center?
To see it, we want to conquer the medical landscape and to be the leading service health providers in Eastern Uganda.
How do you ensure quality health care services at Royal Clouds Medical Center?
One, we recruit the best medical professionals who are dedicated, but also give that very good conducive environment. So largely for us at the Royal Clouds Medical Center to realize that vision is that we look at the professionalism aspect, where we have the best medical professionals who give their best, and they have the expertise to handle the challenges in the health sector in this country.
Okay, so which means each and every sector around here is professional.
Yeah, of course, we are dealing with the life, and here we are dealing with with patients, and then so the most technical field is actually the medical professionals who are at the front. Then we have other departments like administration, the pottery department, where we have the cooks. We also ensure that even when they are not but they also play part.
They do the best.
They do their best.
Okay.
Yes.
So which challenges are you facing as a medical center, and what have you done to address those challenges?
One of them is that there is this narrative that you can't find something very good in the village. And when they come and they find that there is something good in the village, then there is that mindset that we are very expensive.
So which means the way I've seen the environment is looking very nice. Everything is organized. That gives people the image that you are very expensive.
Yes, of course. I even keep bumping into many out there, and I keep asking them, you people, I don't see you. I find you in small drug shops. They say, oh my God, this man, the setting there itself is really very amazing, and we just know that it comes with a cost. And so one thing that actually we are dealing with here is the way we have packaged ourselves. We are smart, and we have really made our standards. So that also becomes counterproductive in one way or the other. That we have packaged ourselves in a more smarter way. We are standard. We want to exhibit professionalism. for them in a village setting, they are used to things done in a kangaroo manner. You know.
Yes.
So and but they appreciate. They say you have good services, but you are expensive.
So what have you done to solve such a challenge?
One, we have actually organized a campaign as a company to do two things. One, demystifying such a narrative that we are very expensive. Then two, sending our marketing team out to go and tell them that this is how we look like. So one thing we are doing is actually trying to do a lot of mindset change, because it's about rotating around mindset. For them to think that we are expensive,
and yet you're not.
And yet we're not.
Okay.
So what one thing we are doing is mindset change.
Okay. So how do you maintain staff motivation and professional growth here?
One, they are entitled to monthly salaries, because that is one thing that can motivate them. At the end of the day, they are given salaries. Then the other thing is we also give them allowances. And then the other thing is we also promise them that let's serve our community. And one thing that also motivates them is that we are growing, and they envisage that the future will be bright as the company, as the organization grows. So one thing that I see them get motivated is that they see themselves growing.
The facility is
growing their facility, and so they are also going to grow. Yes, so that they are also going to make, as a company tries to make a brand, they are also going to brand themselves. That's what keeps them motivating.
Okay, it keeps them moving.
Yes.
So what future plans do you have for the facility?
Of course, the equipment, we want to have an X-ray. In 6 months time, we are going to have an X-ray machine. We are also going to have other diagnostic services. We are also going to have a chemistry machine very soon. And then, of course, to expand. Yeah, we expand, and then also have dental services and other services. So one we are going to do is we want to expand in terms of the physical appearance. We expand, having a larger space. But also we are trying to expand in terms of having expertise, like having consultants. Having consultants, actually. Yeah, even having flying doctors. That is where you're
expecting to be.
Yes, yes.
Okay. So what role do you think the community plays in support to the facility?
One, trusting us that we can do the best.
Okay, they trust you.
Trusting us. Then number two is when they trust us, of course they give us, they will send us clients, patients, they utilize the service. Of course, if they don't utilize this service, it means we shall not sustain ourselves. So it is, their contribution is that they support us. It is a two-way.
You support them, they support you.
Yes.
Okay.
So that we can coexist.
Okay. So how do you ensure affordable and accessible health services in this facility?
One, we talk to our medical professionals to understand that we are starting organization, and we don't have to pay them highly, but we pay them moderately, so that we can charge our clients modest medical bills fairly. But also what we do is our providers, we also look for cheap service providers. I mean in terms of fair prices, like getting drugs. So when we get them, we are also able to serve our people fairly.
Okay.
Yes.
So what can you tell our viewers and all the customers around watching?
for me, as it goes, health is wealth. One thing we must prioritize as a people, irrespective of your area of operation, health is the most critical thing. Once the health component is fully rectified and you are sure of your health, then the sky is the limit. Then you can do other things. First of all, you are sure that you are still living. And when you are sure that you are still having more years, then you get energy to venture into other things because the future is promising. The other thing I will tell them is that at the Royal Clouds Medical Center, we are a service provider. You trust us. We have the medical professionals. We are not gambling, and when you come, we shall treat you with utmost care. We shall receive you, and we shall handle you to the best. And the other thing I will also tell them is that we are not expensive,
As people say.
as people say. You come and see, we are not expensive. So you can trust us with your health. You have your relatives, your dear ones, please, you refer them here or you bring them here. Don't hesitate. We are here to give a quality service. We are not only here to make a profit, but to serve humanity. Yeah, that's the message you can give them.
Okay. Thank you so much, our beloved viewers. Thank you so much for keeping yourself watching. We wish you the best of your day. I'm here with another big officer from another sector whom we are going to interact with in a few minutes. We get to know this and that. Sir, you may first greet the public before we continue.
Well, thank you so much. Greetings to our viewers out there. Thank you.
So, which sector are you handling at Royal Clouds Medical Center, Kasarem branch?
Well, first of all, before I want to thank you so much for coming around. My name is Wanagalia Alex, and the sector, I work in all sectors actually. I work as an operations manager. Currently, I support the operations of the company. I support the administrators and the accounts, finance, as well as the marketing team to ensure that we provide the best services to our customers and also ensure that we strategize to get customers on board. As you know, we are working in a competitive world.
Yes.
You know, there are many other these local clinics around, and so we kind of try to come together, go to them and synergize with them to see that the services they can't offer, then they send customers here.
Okay.
So it is more, my work is more of developing,
assisting this way on the other side.
Yes.
So how do you ensure that each and every sector is running on well, especially those sectors that you assist?
Well, the good thing we have a very collaborative team, in the sense that I've now got to understand all the activities they do, their tasks, and so we keep in touch, communicating, and to see that all work moves on smoothly. So it's about communicating with the team and identifying the challenges that they're facing, and then trying to fix the challenges together.
Okay.
To make sure that operation is
moving on very well.
Yeah.
What challenges do you face in your field?
In the challenges we face, I can say we have internal challenges
and external
and
challenges.
external challenges.
So which one should we know?
So let me start with the internal challenges. The internal challenges in terms of operations, we look at the flow of our work, you know, because I'm supporting here and there. So you realize that there's a lot of friction in the process of trying to execute work on maybe on time. For example, maybe a medical personnel might want to be moving to another branch, but maybe the fuel
to make sure that it reaches in time.
Reach there is not yet, you know, approved and all that, because we have policies in place where things have to be approved, and so there are some kind of bureaucracies. But through communicating with the department heads, with the responsible people, we ensure
it is done.
So it is the communication, like communication and the pushing, that makes people things work.
Okay.
In our operations.
Okay.
Yes.
So what can you tell our viewers who are watching us outside there, plus all your clients and the entire community?
Yeah, but before I cross to the what I can tell the viewers, I needed to talk about the external challenges.
Yeah, I thought you had finished.
No.
Okay, tell us.
Now the external challenges we have, like I told you, one is competition.
Competition from other facilities outside
who are
there.
offering the same services like we do. So like I told you, that one we have the remedy. We have remedified that by you know, trying to synergize with them. So you know, a challenge, every challenge you have to look for
a solution
so that we can survive. Then customers in this area, if you interact with our marketing team, they will tell you the perceptions that customers have, especially here in Kapchorwa. They say our services are expensive and they fear to come. So we are going out there into the community. We are ensuring that we root ourselves down there
into the community
and sensitize them about our services, that and to change the mindset, because it's about their mindset, that the services, looking at how our facility is. You know, they always tell us that we have the best facility in terms of cleanliness, in terms of whatever. People in this Kapchorwa, especially in this Kapchorwa, say there is no any other whatever. So people just look at how we are
and they think you're expensive.
We are expensive. So that is the myth that we are trying to remove. We go out there and tell them, no, our services are, you know, are fair. This is how we charge, and by the end of it all, they come to appreciate that, you know, it's not like how they have been thinking. Yeah. So my message to the people,
public,
our viewers there, our customers and the whole public, we invite you to come to our facilities. We have good customer care, and we have professional doctors who are there, professional nurses, and people who are here to serve. We are in this community to serve, to create impact, you know. So we want people not to fear. They should come confident that they are going to get the best service. You know. Yes. And if the condition cannot be handled, we have referrals. We can make referrals to places that you know, can help. Yeah. So we are here to solve problems and help people. We are one of you outside there. So please feel free to come and be treated with us and get our services. Yes.
Thank you so much, our viewers, for watching us. We are still at Royal Clouds Medical Center, and this is Kapchorwa branch, and we are now in the laboratory. We are going to interact with the officer in charge of the laboratory so that we can get to know how things flow here. But before we reach any further, Let's first give her an opportunity to greet the viewers before we proceed. We get to know her name.
My name is Saum Chebet, lab attendant, Royal Clouds Medical Center, Kasarem. Yeah.
So, how are you doing today as a lab attendant here? How are things flowing?
Things are moving well.
Okay.
Yeah.
There's no other problem.
Nothing bad.
Okay. What are your common lab tests that you do daily?
Okay, thank you. The common tests we do here daily, we do CBC, that's cell blood count. We do MRDT. We do a BS for malaria parasites. We do H. pylori. We do RBS. We do typhoid tests. We do rheumatoid factor, brucellosis, and many others. Yeah.
You do very many. So how do you ensure accuracy of the results?
Okay, we do quality results. Then after we take a sample, we do our procedures. Then we see how our best our results are.
Okay. So what challenges do you face in your sector?
Okay, like some of the challenges I face here. One is I miss some tests like chemistry. Chemistry machine. That's, let me say, like we do like RFTs, that's renal function test. Then liver function test. Then we also miss like ESR machine. Yeah, those are some of the challenges.
Okay.
Yeah.
So how long do most tests take, and how do you reduce the delays?
We don't delay much. It depends on which test are you doing. Yeah, like when you're doing BS, that can take some much time, like around 30 minutes. Then when you're doing like this other rapid test, like 20 minutes. So it doesn't delay. Yeah.
What improvements do you suggest that should be put on ground so that your services can move on more smoothly?
Okay, like I will request they can get me chemistry machine to move better. Yeah.
So what can you tell the viewers who are watching us and the entire community?
Thank you. Tell them you're welcome to our family, this Royal Clouds Medical Center. We are happy with you, and we are really appreciating them for their support they've been giving us. Yeah.
Okay. So ladies and gentlemen, once again, we are still at Royal Clouds Medical Center, Kasarem branch. I'm with the receptionist, whom we are going to discuss with a little bit. And she tells us this and that as far as Royal Clouds Medical Center is concerned. Let's allow her to first greet us before we proceed. Sister, can first greet the viewers before we continue.
Okay, thanks. Hello members. Praise God. This is Namemba Ida, a receptionist at Royal Clouds Medical Center, Kasarem. Thank you.
Yes, how are you doing today?
I'm fine, though it is very cold, but I'm coping up with the environment.
Okay. So how do you manage patient registration and the file storage?
We register the patients in a computer. Also, we have some books where like we register the patients, so we ensure that the files of the patients are kept safely. If the book is very far, we can use the computer. If the computer, we are having a problem with computer or power, we can use the book.
Okay. So what challenges do you face when you're handling many customers, assuming the customers are very many, what do you do?
When the customers are very many, I call the nurse for assistance to come and help me record some like documents, like patient's name. They want the vitals also to take. She can play that part when there are too many for me.
Okay. So how do you ensure quick services, quick and friendly services to the customers?
Effective communication is very important. You have to know the needs of the patient and you triage them according from number one who came first, then to the last, like that. So we follow the numbers. Like we serve the first patient, the patient who came first, then the one who falls like that to the last.
What improvements do you suggest?
The improvement as Royal Clouds. We should add more staffs, more especially on busy days, like when we have much customers, we need like 2 receptionists and 2 nurses on the on duty.
So how do you ensure confidentiality here?
Confidentiality. We by keeping the secrets of the patients. We don't tell this one, the other one, like that.
You keep the secrets. What can you tell our viewers?
The viewers, I welcome you to Royal Clouds Medical Center, whereby we offer quality services here. So we welcome you to Royal Clouds Medical Center, Kaselem. Thank you.
Bwebulebe mwesizana mwanyana nabikubanga mfulenga tap media sironko kirero kuli ni nenyene kubobo baba bezere kubanga afunako bujjanjabi mu services the Royal Clouds Medical Center eranga kuli mu Kasarem branch kukugana naye kubeko ni report yes kufunako kwa mamba customer bawe beko ni chesi bakubulirako mai meno go batina
meno go sabana nga bati Josephine ne yona
wamira Okay. Iwe ngesi weze uletera omulwale omuzi njawulo kina Yesu uboneko kubulambo omulwale
mulwale ono Yesu komuletera dwaliro lino kina kulewula oti dwaliro liri omuzungu ijanjaba nabi alo babezako nga beza babajanjaba beza nga bawelle nafukwama kuti yakusudeko omwana wefu omwana kukwireko miliyoni era zimbala zesikwezeremo ebezimbi nabi
nesaika n'okubona oti zakyukireko
sayi zakyukireko banga beka adyakanywa nikukusiira beka asiira nenga sayi ng'okumulanga aliko akusiira
ekyogesa kiti eriwo enjawulo
eriwo banga ali kudyako
miwendo gyesasula giri gitya najja abaminirisa nabi namo Miende siringi zesi musasula hano chini zibaminirisa nabi
akuminirisa
so mai nayo kinachonyala abulirako balwale bandi balyanze kina bakikuzula esi bujjanjabi bulinga bushina dawe
bujjanjabi nga bwimba bulako bamali balyanzeho babama bani balwale bati bakalwala enyuma ayo da beze kweno naye baboneko lidwaliro ni bujjanjabi butafunabi beze naye babalete balwale babajjanjabi ngeva kuledire.
Kale wasimile nabi ekinabere nyene kubo baklienti ba Royal Clouds Medical Center Kasarem branch fana mwawulire byesaga nikireke byamire mukana Mose dawe wasimile nabi mwanyana nabi. Ladies and gentlemen, we are still at Royal Clouds Medical Center Kasarem branch and I'm with the security officer. You know, in every home you go there must be security measures, and for Royal Clouds they have security personnel with the combat. But before we go any further, I allow him to first greet us, tell us his name before we continue. Papa, I can greet the viewers before we proceed.
Good afternoon, visitors. I'm by name Sheptoek Hamid, a security guard at Royal Cloud Medical Center.
Thank you so much.
Yeah.
What are your many duties that you do here?
The main duty which I do here is to see that all the properties of the facility are in safe hands. Yeah, that's my work.
Okay. So how do you manage patient and visitor access to Royal Cloud?
I have now a visitors book. When they come, they give them that visitors book. They write there their names, where they are from, contacts and the way they want. And at the time they have arrived, they sign. Then after finishing that, then I take to the nurse. I explain the way the client need to be helped. Yeah.
So in your field as a security officer, what challenges do you face?
Challenges now that I face is that when you look at some clients, fear to write their names in this visitors book. That's another challenge. Because they complain that I've seen some already now sick. Why this time me to again that they write here your names?
Okay. How do you ensure safety during peak hours? How do you ensure safety here?
Now with safety, when I'm here, I'm to move the whole facility.
You check
to see that everything is at its position. Yeah.
So now, what improvements do you suggest so that the security can be more improved here?
The suggestion that I have, because when you look at when now it is now raining, it is now very difficult to move in that rain. I need to be given a raincoat. And the coffee so that I will be using to patrol the facility.
The facility.
Yeah.
Still at Royal Clouds Medical Center, we are in the laboratory, as you can see. So as we try to interact with the laboratory personnel and we get to know more. Papa, you can first greet the audience before we continue.
Thank you so much. You're most welcome. By the names, I'm Opolot Patrick, laboratory assistant here at the Royal Clouds Medical Center.
So here at Royal Clouds, we have seen the environment is so good. I believe the services are moving on very well. Yeah. What are the common lab tests that you handle here?
Basically here at the lab, we do these common tests like MRDT, that is now to rule out malaria. Then also we do BS, that is now microscopy, to rule also malaria. Then we have WIDO, that is a typhoid test, that one's for typhoid. We also have H. pylori antibodies, that is to rule out H. pylori.
Okay.
Then we also have blood grouping, mostly that's now when you come, when you want to know your blood group, we can do for you that test.
Okay.
We also have rheumatoid factor. That is most people when they go, like when they grow around 70s there, they develop the knee, the joints. So we can use rheumatoid factor to rule out that arthritis. Okay. So we also have urinalysis. That urinalysis, we basically do the urinary infections. Mostly they are experiencing those infections. We also have urine SCG, that one for testing pregnancy.
Okay.
We also have hepatitis B. Hepatitis B, that's now to rule out this hepatitis that can affect the urine, the liver.
The liver.
On top of that, we also run stool analysis. Basically, we get the sample of the stool, then we run that one to check those intestinal worms like the liver flukes. We also have the Ascaris lumbricoides, mostly around the kids.
Okay. Thank you so much. You've told us a number of tests that some of them I'm hearing them for the first time. You know, the medical language is too complicated for some of us. So how do you ensure accuracy of results?
Basically, accuracy of results, that one starts from the time of collection of the particular sample. Like if I'm requested for a urine sample from a patient, there is a specific amount we will need. Like that container, if we give you a certain container, you're not supposed to bring too much. Then also you should not that in that container. Meaning if you bring a dirty container, automatically the results are going to be contaminated. I may give you wrong results. Then you have time taken. Assuming you are testing a BS to rule out malaria parasites. So a BS, I'm supposed to get a sample from a patient. I'm supposed to make like a smear. A smear is like when you get a slide. I'm supposed to spread the blood in that slide. Then I'm going to allow it to dry. After drying, I'm going to stain. After staining again, we are supposed to dry. Then now there I will examine. It means a patient should also first of all be patient. Like from the name.
Patient should be patient.
As patient as a patient. So like that one, it may take like 10 minutes for me to bring the accurate results.
Okay.
So accurate results, it will determine from the patient. If the patient is not patient, definitely I will bring what? Wrong results.
Okay. So what challenges do you face with the equipment or supplies here?
So far, there are no much challenges that I'm facing, but only the challenges that are here. Sometimes from the clients, that's the patient. They can come, maybe a client may come when there are two couples. So they may come like they want to test HIV. But in your mind, you know that there are two things that are going to come, negative and positive. But now the other one who knows his results or her results, she is positive. So she may tell you that don't
tell out
that I'm positive. And yet in the medical field, professional, you're not supposed to give the wrong results.
So what do you do?
I give them the right results.
You give them when they are two or one on one?
Actually, now that one, I will take them to the doctor. It's now the doctor to now explain to them, or a counselor. Is now the one to guide them on that particular occasion.
Okay. How long do most tests take, and how do you reduce delays while testing?
Mostly the tests that take long, it can be like CBC. CBC, that's complete blood count. That one we're running all the parameters of blood, like the platelets, the red blood cells, the white blood cells, then the lymphocytes. Basically, it can take around 15 minutes.
So it is the longest?
It is the longest, because after we're going to print them, so it takes long.
What improvements do you recommend for the lab services here, so that they can be better than for today?
Okay. You know, today we are in the world of artificial intelligence. So there are now automated machines that run results around 5 minutes. So those are the machines we have requested, and with them I'm going to receive them.
Okay. To ease the service.
To ease the service.
What can you tell the viewers and your clients outside there as we wind up?
What I'm going to tell my viewers out there, that Royal Clouds Medical Center is a family where we are testing many tests. People come here, and the services here are affordable, and the person who's running them is a qualified person. Come here, feel free. I can run your tests. If you come with those couples that come, they want to know their status. Please, you're welcome. You'll get me here anytime. It is open 24/7.
Okay. Thank you so much, our beloved viewers. It has been MC Porigno, Mash Pro behind the cameras. Thank you so much for watching us. I wish you the best of your day. Chili ku Royal Clouds Medical Center Ibuyaga elanga sayi kano kuli ni bachafe bakola kuchekudya ni buyonjo mu kisinza kiki ke yaya yukanyo akucheseko akubulye komeno gewe niyo ni kuben kuyongera ya meno go batina
Gange bananga bakintumisha ikola mu Royal Clouds Medical Center ngomudeke
ubulongosa akutwe amilisa kubulireko iwe biranu byesu ukola ku making sure ti kifo kino kina kiri kiyonjo mvude kina wesi unyukiramu iwe bizi kukina byesu odiani neko ni nabyo muri nego ngese asa mini mujoji nga wotamba bifo kina chesugo mo kina chesugo no chitaga kongezo mini mujoji jenda kula
ndamezi galini kubaho batibone bulamu nibye kudya kubaho naja mimi jende bulaya.
Okay. Kina chesi ukolo tiena niyo no making sure ti bulwale kebugenda anadawe uno kina dalanga bulwale buwambaga batu kulwe buchafu
ni kumaking sure ti buli chini kuba kiyonjo kusinga ko vitu wanikila kongo amale kusinga byoma na wabingisa mugati ni kusinga ko uniform umalo ogolole ni masuka nago ni kugolola ne bulwale buleke kuwamba batu.
Okay. So binani byesu subiroti byandiberenga bibawo babiweli biretewa mu office yo onge owe ukilininga niyo ni milimo gino kina ginyalise kubanga gigenda bula inabi kusinga konge esijibere.
Vitu bini kweza munyanga ngabye kudya bini kweza munyanga naje abadye munyanga tekoni gamezi kubaho nekwasobolesa kukilininga lidwalo lyefe liboneke bulayi.
Bitu kina bindi byesu utambisa mu kukilininga kuki
kosa liquid soap ni sabuni ni jiki naje abitu byefe biboneke bulayi.
Okay. Kina chesu nyala abulira ko bakasoma benye bose ni bakukubona hanze yoyo ngesi kumaliriza
abula tubalini kweza nga mbere balwale batu balwale balini kubaleta kubanga idwale no bijanja babulayi batu bebatelera bagoba aluni bati balwale da bagosa ujuzi bati waonesera wakujanja babulayi.
Okay. Wasimine nabi bayabe famous zana mubere kutaku media muberenga mu followinga Royal Clouds Medical Center Ibuyaga waganisa unakulula. Ladies and gentlemen, my name is MC Porigno. I'm here to inform you about Royal Clouds Pharmacy in Buyaga Town Council. This is Bulambuli District, where you can get all the drugs that you need for your pharmacy. You have any health providing clinic there, you can just come here and pick the good drugs that you can use and heal your people. I want to inform you that the prices are fair. Everything is moving on well and the services are 24 hours. We are still at Royal Clouds Medical Center Buyaga. We are now in the pharmacy, as you can see. The drugs are here. We are now with the pharmacy team. We are going to interact with them a little bit. and they also get to tell us. So, sister, you can first greet the audience before you continue.
Thank you so much, Mr. MC. My name is Cherotich Naruha. I'm working at Royal Clouds Pharmacy, Buyaga. Royal Clouds Pharmacy, Buyaga, we do both wholesale and retail. We deliver drugs to different places. We also allowing people who come in with prescriptions, who got the hospital, come with a prescription. Then we also give you the drugs according to the doctor's prescription.
Okay. So here at Royal Clouds, we have seen things are moving on really very well. So how do you ensure the patients receive correct medication?
First and foremost, we ensure that we look at the doctor's prescription first, and we have to understand them. Then also we ensure that we follow up the patient's past medication history, like finding out what the patient has been on. And also as pharmacists, we learn more about medicine. So we also look at the patient's condition, we ask for more signs and symptoms, and as they tell us, we also come to a conclusion where necessary, we give the appropriate drug that will help the client.
Okay.
Yes,
So how do you manage the drug stock?
we have our system. Every drug that comes in, we enter them in the system. Every drug that goes to a different branch of ours, we also do a material transfer from our system to the other system. We also have in our invoices as they come in. We count whether they are tallying with what we have physically, but mostly we use the system.
Okay.
Yes, yes.
What common mistakes do patients make when taking the medicine?
One, they don't always follow doctor's prescription.
They do as they want.
Yes. Secondly, they take drugs at their own time. Like if they say 6 hourly, there are drugs that are strictly supposed to be taken on time. So if you don't take them on time, that means you're suppressing the microorganisms, and you will treat yourself, continuing treating yourself, but still they will not heal.
Okay.
Yes, yes.
So how do you educate the patients on dosage and the side effects of these drugs?
When it comes to dosage, mostly when it comes to medicine, we always give dosage according to the age, the weight. So there is a different dosage for adults, and there is also a different dosage for young children. Yes.
Okay. So what improvements are needed so that these pharmacy services can be improved or better? What improvements do you expect so that the pharmacy services can be better?
Mostly, we only need compliance from the patients, because the more the patients comply, that's how the pharmacies are going to work.
Okay.
Yes, yes.
So what can you tell the viewers and your clients as we conclude?
Yes. To the viewers and to my clients, whenever you come in with a prescription, mostly to the clients, come in with a prescription and take the drugs as prescribed or explained to you. And that will help you heal and will help you recover quickly. And then to my clients, I really appreciate you guys for coming this side. I really appreciate your support. And I pray that you continue supporting us.
Okay. We are still in the team that is concerned with pharmacy, and we are having another service provider here who is going to say something to us. Madam, what are your names?
Nandu Trecho. Yeah, I work for Royal Clouds as an enrolled nurse. Yeah.
What appreciation message can you give to the public and the viewers watching us?
Today, I do appreciate actually our clients. We really thank you for your support. Thank you for supporting Royal Clouds. Like, it's not easy, but we really appreciate. We appreciate you coming around, and we really have professional staff that it's going to like give you the professional services that you need. So today, we appreciate you. We appreciate our bosses. Thank you for helping us, like support our dreams and everything. The community around, yeah, Viaga is not all that bad as you see, and you're really supporting us. We really thank you, and we ask of you to come because the prices are fair and every service that you need is at part. Thank you.
Okay. Thank you so much. That has been one of the staff members in the pharmacy sending her appreciation message to the public. Thank you so much. Have the best of your day. Ladies and gentlemen, still Royal Clouds Medical Center. This is Kasarem branch. I'm with one other big man here in the pharmacy. We still want to find out more, but before we proceed, allow him to first greet us before we continue. Bro, you can greet the people watching us.
Okay, thank you so much, sir. Hello everyone, call me Victor Arapkakisha. I work here in Royal Clouds Pharmacy as a dispenser.
Okay. So here at the pharmacy sector, how do you ensure drug supply and its safety?
Okay. Once more, we have a few things that we always do here in Royal Clouds Pharmacy to ensure the safety of the drugs here. In fact, right from the time we receive the stock up to the time of dispatch. Here, ideally, we have a well-organized store where we keep our drugs. Drugs are kept in shelves, not direct on the ground. Those ones which are specifically staying to the ground, specifically we put them the fluids, of which we have the pallets on top. So briefly, that is how we store our drugs. On top of that, we also have the temperature gun, which is attached on the walls of the shelves to make sure that we monitor our temperature of the drugs. And on the side of dispatching our drugs, ideally we don't just supply survey here. We supply drugs across the country.
Like in which places? Right now we are in Kasarem, this Kapchorwa district.
Yes, yes.
Now, which other districts do you supply?
We supply Lower Blambuli. We go as far as Karamoja region. Teso region we also supply, and the other sides of Buko, the borders between Uganda and Kenya. Yeah, we also have other places like Amuda. At times we also take our drugs up to there. So that is our best and quality, the drugs that we have. That's why you see that we go as far as those other ends. Yeah.
How do you ensure the availability of the drugs in this pharmacy?
Okay. Often here we ideally order drugs twice in a month. And whenever a customer comes and it finds that we do not have the drugs, we always have our book for the new drugs, and we also have a group chat with these guys of KPI, these physicians who always manufacture drugs. They keep on updating us as a team for Royal Clouds Pharmacy here on the newly daily made drugs, and that is how we always ensure that the drugs are available here in the pharmacy.
Okay. What can you tell the people watching us before we go off?
Actually, the things that I can tell the people who are watching us here is Royal Clouds Pharmacy Kasarem has come to help. Not only helping the people of Sebei, people of Blambuli, but helping each and everyone, be it within the country and also across. We have here well-stocked pharmacy. We have here all quality drugs. We have here a well-qualified staff with a duly practicing license, actually up-to-date practicing license. So that implies that they are able to offer you the best quality service and the right drug. And we are also here daily being supervised by the National Drug Authority, meaning that the drugs that we are dealing with here, we consider people's health first. So the good news that still this Royal Clouds Pharmacy has for the people listening to us outside there is we have all drugs available here. Each branded drug we can always offer to you. Those ones which are not available, as I told you earlier, we have the people who keeps on updating us with the new drug, and we always deliver where necessary. So that is the good news.
Yes, ladies and gentlemen, you're most welcome. Thank you for following Royal Clouds Medical Center, our story since we started. We are still at Royal Clouds Medical Center. Now we are in Kaserem, one of the branches that is providing health services to the people around this area. We are now in the pharmacy, and alongside me I have a beautiful lady here who is serving here as the receptionist, and she's going to tell us how is the pharmacy flowing. I think she's receiving people in the pharmacy, and she's going to share with us a few ideas. But before we go any further, let her first greet us, tells us the names, and then we go on with the program. Sister, you can greet the public.
Hello everyone, my name's Esther Ikilai. I'm the manager, Kaserem Pharmacy, Royal Clouds.
So, sister, how are things flowing here?
Things are flowing well, there's nothing bad so far.
Okay. How do you ensure that patients receive correct medication or the medicine that they are supposed to receive?
Actually, here in Royal Clouds Pharmacy, Kaseremu, we have a clinical officer who helps us in most cases prescribing the drugs for the patients who come in. And we do wholesales, and retail.
So how do you manage drug stock?
We use paper route, like first in, first out. That route helps us to identify the expiring drugs.
What common mistakes do patients do concerning taking of medicine?
Self-medications. Someone comes telling you, I want such and such a drug. Even if you give someone an option, will not accept.
Okay, so they want to take the medicine of their own choice.
Yeah, that's self-medication.
So how do you ensure, do you educate your patients or your clients so that they can take the medicine positively? Let me say on the side of dosage, how do you educate them?
On the side of dosaging the drugs, we actually convince them how it's supposed to be taken and the right drug for the right maybe disease like that. Yeah.
So do you also educate them on the side of on the other side effects?
Yeah, we do.
Okay. And I think that is one of the things that has enabled you to stand. Okay. Which improvements do you suggest that should be put on ground so that your work can flow better?
We need to expand the place because we receive a lot of clients out. Then maybe massive advertising of the place for the community.
So what can you tell the people watching us and the entire community at large as we conclude?
Okay. We offer retail and wholesale services. Our prices are good.
Thank you so much, our dear followers who have been following the story of Royal Clouds Medical Center. It has been Kaserem branch. I just pray that you come and witness the best health services around. Have the best of your day.
Okay, hello team. So here we are now in a Royal Clouds Pharmacy store. This is our store. You can see drugs are kept in shelves. These are the creams. At the bottom here we have some syrups. We have the other side, we do keep our cotton, the gauze. We have some plasters there. Then this other side, we ideally keep here fluids. There is some Ringer's lactate here and D5. You can see we don't put the drugs down. At least we raise them with some pallets on top to ensure that drugs are really safe for human consumption. The other side we do keep our envelopes. Then the other side also we keep our cotton and then the grape bandages. Here we keep our boxes. Those boxes helps us to transfer drugs to different places as we earlier stated about it. So this is briefly our store. And these are not the only drugs we have. Our drugs are still on their way coming. Ideally, you always find that every part here is filled. As we stated earlier that we really keep stocking the drugs at least twice in a month. So that is what I have for you about the store. Thank you.